And with that, let me recognize Dr. Wenstrup to inquire.
Thank you, Mr. Chairman. Thank you all for being here. I think I could sit and talk to you all for a good hour or so at least. But let me just start. I served on Cincinnati Board of Health, and one of the things that we engaged in was infant mortality because we recognized our numbers were going up in infant mortality, and we started looking at things, and we found the trends like zip codes and race and things like that that seemed to be factors or common denominators anyway. The problem, and what was interesting too is, as we're looking at things, we're saying, well, why is this happening? Is it because of access? Is it because of education? Is it because of lack of perinatal care? We found that some of the mothers didn't even come in to see a doctor until it was a month before they were due. I mean, so then you really recognize, okay, we've got a problem here. So there's so many factors. Dr. Rossi just said, the more data we get, the more we got to look at, and there's not everything is medical, right? It's transportation. It's a lot of things that go on, and I think we have to look at that. And Ms. Felix, I was kind of struck. You said I was unaware of the risk, and I think that especially in this age of liability, and we always get a consent for things. It's kind of amazing that we're not doing that someone's not saying, oh, and by the way, you're African American, so there's a higher risk for preeclampsia. I want you to be aware of that. Look for these signs. We need to do a better job of that. That was very eye-opening to me that was your situation. And especially if there's a predominance of something either from your geographic area or your ethnic background, I think it's important that we do that. And obviously, we always have to look at, comorbidities and other factors. Is a patient, are they smoking? Are there drugs involved? Is nutrition adequate? Obesity? Is their home safe? I mean, all of these things, come into play. So when I got elected, I not only had urban area, but rural area. And there was actually a priest in my district who was a family practice doc. He had 2 parishes, a full-time family practice, and he did deliveries, and he did all the high-risk pregnancies. And in our area, it was a lot of the drug addicts. But I tell you, he was the example of trying to make sure everything was done. I had a car dealer tell me, this guy comes in and buys used cars for the mothers so that they can get to their appointments. But you see, he recognized that this is more than just one component. It's all these factors that come into play in dealing with. What a great example, and I was glad I got to know this doctor before, he passed away. In surgery, so I'm from a large orthopedic group, and we don't want to do readmissions, right? We're penalized for readmissions, but we're doing elective surgery most of the time, right? You're getting a knee, a hip, and this and that. So one of the things we started doing is you're going to stop smoking before we do your surgery. You're going to lose weight. You're going to do physical therapy beforehand. We're going to do everything so that the outcome is at its best. Well, delivering a baby is not an elective procedure, right? So you don't have that. I guess what I'm just asking now, thinking outside the box, how do we embrace all of these factors, try to bring it together so we optimize our results, that we make people aware of the risk, which if you're not aware, then it's hard to stop it. So there's a lot of things we can bring together, and I'm really looking forward to working on all of this with you. And I think if some of the, like Children's Hospital in Columbus, they said, we take a Medicaid ACO, we get paid so much per child. So how do we succeed? We make sure they're healthy. We make sure they get their vaccinations. We'll go to their house if we have to, to make sure that they get taken care of. So how do we do that in this environment, and what are your thoughts on that prospect? I think, we're talking in the right track. Can we do more? Whoever wants to weigh in on that. Dr. Felix, I'm just kidding.
If you don't mind, I'd like to speak to that briefly. We have a very similar model with a Medicaid health plan working with our facility, and have a pregnancy medical home model with that same goal, right? When moms are healthier, when their children are healthier, the entire system works better. And that model has definitely shown improved outcomes for pregnant women and their children, reduced rates of cesarean delivery, reduced rates of NICU utilization, and better outcomes using care coordination, increased touches with both telephonic and in person. So the model that you mentioned is something that could be useful.
Thank you all very much.
Thank you, Doctor. With that, let me recognize